Hello. Okay, please come in. You're very welcome. And your name is? Okay, I have your... Yeah, I've been expecting you. This is your first session in this clinic, isn't it? Right. So, okay, let me go through what is going to happen today. Nothing difficult, hopefully, for you. First, I'm going to ask you a few questions, a few medical questions. Something that your GP would probably know, connected to your doctor, body. And then the second section is going to be, I'm going to ask you quite a few personal questions, I suppose. So if you feel like you're uncomfortable replying to any of this, it is absolutely okay. But if you do decide to reply, please be as honest as possible. This is all I'm asking from you for today. Okay? Now, do you need time to prepare yourself? Would you like a cup of water? Would you like a cup of, I don't know, decaf tea, chamomile tea? Unfortunately, we do not have any caffeinated drinks. Yeah. Okay, so you're okay. Right. So let's start then. I'm going to be writing things down as we go along to mark it for us. So today is going to be pretty straightforward, and I'm going to read your questions out and mark them as we go along, okay? Okay. Ready? So we know your name and we know your surname. We also have your mobile phone number. Could I please have your address? Okay. And your email address, if you have one. Would you mind spelling it for me? So it's your second name, last name, and the number, okay. And at .com. Okay, perfect. Now, would this be okay if we are to send you any information about the clinic or any special offers we might have? Okay. Okay. And may I ask you for your next of kin, please? Could be anybody, the closest person to you, or whoever you choose it to be. Okay. And their phone number? Okay. Okay. And what is your relation to this person? Okay. Okay. Right. So I've noticed you have a bit of an accent. Would you mind providing us with your first spoken language? I hope you don't mind me saying so. It's just in some cases we might have doctors who might be able to talk, so they might be able to help you better if perhaps you'd be able to explain yourself better with them. Okay. Okay, we might have somebody who does talk. Okay. Okay. Do you have any blood pressure related cardiovascular problems? Okay. Perhaps you know your height and your weight? You prefer not to say. That's no problem at all. This is just the general questions that we do need to ask, because we are a clinic, even if it's we are not a GP or anything like that. Now, do you have any of those following diseases? High blood pressure, we already determined that. Cancer, okay. Arthritis, okay. Diabetes, okay. Skin diseases of any sort? Asthma? Epilepsy? Okay, any problems with thyroid? Okay. Anything else you might want us to know about? Okay. Let's continue on. Now, could I please ask you about any potential stuff that your family might have had, or any family history of any diseases? Stroke? Okay. Okay. From both sides? Okay. Okay. Diabetes? Okay. Asthma? Okay. Okay, and anything else? Heart problems? Okay. Okay, from your I see. Thank you. Are you on any medications? You're not. Okay. Okay. Let me just quickly go with the questions, because some I have already answered. They're kind of repeating. Now, do you drink alcohol? And how often do you consume alcohol? Would it be, well, a few times a week? How many units, if you could remember? Okay, so very, very rarely, isn't it? Rarely. Okay. Okay. Do you have any hearing impairment? Okay. What about visual one? Okay. Okay. Okay, so this concludes the health questionnaire that I was talking about earlier. Now we're gonna start with a little bit more private, not private, but perhaps more sensitive questions. And as I said, if you feel like you don't want to answer any of them, you do not need to. It is absolutely okay. Okay? You ready to start? We are here, just to let you know, we are here not to judge you. We are here to help you. And the more information we do get, the more we'll be hopefully able to help you. Okay? Okay. So, during the past months, did you have difficulty falling asleep? Difficulty staying asleep? Feeling that your sleep is not sound? Okay. Feeling that your sleep is unrefreshing? Okay. During the past months, right, so we've determined, so you have a bit of problems falling asleep and staying asleep once you do fall asleep. Right, so we've determined that in the last months at least, you do have a bit of a problem falling asleep as well as staying asleep once you do. So would you mind me asking a few further questions on this topic? Okay. In the past months, how much do your sleep problems bother you? So from 0, not at all, to 4, being extremely. Okay. How much sleeping difficulties affect your work? It's the same for all of the further questions until I say it's either 0, not at all, or 4, extremely. Have these difficulties been affecting your social life or private life? Okay. Have those sleeping difficulties affected your irritability? Do you feel like you are more irritable because of this? From 0 to 4 again, please. Okay. Do you have trouble concentrating because of the sleeping? Yeah? Okay. And how sleepy do you feel during the day, normally? From 0 to 4. Okay. Okay. So we started with the initial problem that you came to us because like the reason why you are here. But just from judging from what I'm hearing so far, do you mind if I ask you a few further questions? Okay, let me just get those forms so I can fill them out. Some of those questions might repeat, but it's just I'm trying to determine a little bit from what I'm hearing. Okay, that's okay. So, do you often feel tired? Okay, of course. Are you often troubled by attacks of nausea, perhaps? Okay. Do you feel like you're more nervous than other people? Please. Do you often have headaches? Do you often worry about money or business? Do you often worry about anything, any kind of misfortunes, and just in general you're nervous about things? Okay. Do you often see nightmares when you do fall asleep? Okay. Your hands and feet normally warm enough? Yes, some of those questions might seem non-related, but they do make sense to us. Okay. Do you sweat easily? Do you feel hungry often? Just about normal. Okay. Now, do you have any stomach problems like constipation or perhaps the opposite? Do you dream frequently when you fall asleep? Are you easily embarrassed? Do you find that you are more sensitive than other people? Do you often find that you worry about something, like ruminating on something at all times, and you can't let go? Do you often feel like you could be as happy as others, but you are not? You see others being happy. Okay. Do you cry easily? Okay. Does it make you nervous to wait? Is it difficult for you to keep in mind a task or a job that you need to do? Remember that you have to do it. Are you lacking self-confidence? Do you sometimes feel like you're falling apart? Okay. Thank you. there's just one last set of questions that I need to ask you, okay? You don't mind. These are going to be a little bit different. It's just I'm trying to determine because I'm seeing a couple of different things that I think it could be, but I just want to make sure that I'm right. Okay? You okay? Do you need water? Tea? Okay. No, you're okay. Okay, you want to continue? You're going to be finished with this for today. Okay. Great. Are you often overwhelmed by sensory input? Okay. Do other people's moods affect you? Okay. Do you feel like you notice the subtle things, could be nature, could be in the house, easier than other people? Do you often find yourself needing to withdraw on busier days? More so than other people? Yeah. Do you have complex and rich inner life? So, say you're thinking about a lot of things and just... Okay. Are you made uncomfortable by loud noises? Are you conscientious? Okay, 1 second. Are you moved easily by arts and music? Do you startle easier than other people? How do you, yeah. Do you get easily frustrated when you need to do a lot of things in a short space of time? Okay. Would you consider yourself clumsy? That's a bonus question. Okay. Do you find yourself frustrated or angry when many people try to get something, try to talk to you all at the same time? Is it easy for you to forget other people's mistakes? Do you become unpleasantly aroused when there are a lot of things going on around you? It could be good things, but it's just you don't really like it. When you get hungry, do you find that you lose your concentration and you get easily irritable? Easier than other people? Do changes in your life, it could be good bad changes or bad changes, neutral changes, do they shake you up? Do you notice and enjoy delicate things? Say the smell of roses when you pass by somewhere in the garden, a bird singing, just as an example. Okay. Do you find that you need to make sure that your life is well organized in order to avoid chaos and unnecessary kind of frustrating? Yeah. Are you bothered by loud noises and intense stimuli, meeting new people? When you were a child, would your teachers or parents describe you as shy? Okay. That was the last question. We are done for today with the questions anyway. Yeah, so I cannot give you any diagnosis, and being quite honest, I do not think you need medication from what I'm seeing, or at least we are gonna go with the route of trying and not to give you medication. We try to operate on the system that we could try everything we can before we go that route. That's okay with you. So I'm gonna make an appointment with you if you have time. Would you prefer the doctor who speaks English or the doctor who speaks your mother tongue? Okay. And when are you available next? As soon as you can. When you're available next, you're gonna try and find a doctor. Okay, so those days you're available. Okay. Yeah, the clinic is open 10 a.m. to 10 p.m. But we just need to make sure that the doctor is available on the day. Okay. Yes, I'm gonna write down your appointment. Yes. Okay, so we'll see you in 2 days then. Until then, try to meditate if you can. I would highly advise it. If you cannot, just accept it. I often find that I feel more frustrated personally when I'm trying to meditate and then I can't for whatever reason. I just accept it then. But then I always try. Anyway, we shall see you in 2 days, and thank you so much for coming over. Okay, see you soon. Thank you. Bye bye.